Welcome back to AM Northwest. February is American Heart Month. Do you know your numbers? Here to tell us which numbers we need to know and why, we welcome from Providence Heart Institute cardiologist Jason Bensch. Hi, Jason. How are you?
Good. How are you doing? Thanks for having me.
You bet. So what does it mean to know your numbers?
When we say know your numbers, what we're talking about is your lipid numbers or cholesterol, things like LDL cholesterol or triglycerides, blood pressure, weight, blood sugars, or A1C. Knowing these numbers are really important because abnormalities in any of these things can increase your risk for heart disease. And unfortunately, heart disease is still the #1 killer of men and women in the United States. And so controlling these risk factors for heart disease is super important.
So when should we have those numbers checked, and then how often?
Well, since cholesterol problems are so common, most physicians will recommend checking your lipids at an early age. And these tests are quick, easy, and cheap. So most doctors will say check it once during childhood at least, and again in early adulthood, maybe around age 20. After that, if your numbers are completely normal, then checking your numbers every 5 years. If your numbers are abnormal or you're on medications, checking them once a year, or earlier if you have any changes in your medications. And I think most importantly, if you have a family history of heart disease or high cholesterol, you really should be screened at an earlier time to try to identify that risk earlier.
Yeah, because someone who can look perfectly healthy and normal and good shape can have high cholesterol.
Yeah, they may not even know it.
Yeah, absolutely. And then pandemic stress, I'm sure, has caused the numbers of our blood pressure to go up.
Yeah, I mean, we all know that it's a stressful time right now. The pandemic has disrupted our lives in so many ways. And hopefully things will start to get better soon. But a lot of our healthy habits like cooking more often or going to the grocery store or going to the gym, that has become more difficult during the pandemic. And stress can lead to bad habits like bad sleep or bad eating habits. It can cause people to gain weight. And that all can lead to higher blood pressure. And the thing with blood pressure is that, again, you may not know that you have high blood pressure. It's usually associated with no symptoms. And so getting screened for high blood pressure by seeing your primary care provider or at least buying a blood pressure cuff at home is something that you can do.
Why is high blood pressure a problem, though? What is the issue there?
Well, high blood pressure is a huge risk factor for cardiovascular disease going forward. And it's actually one of the most important risk factors that we have that we can control with medications. And patients who are on medications and have appropriately controlled blood pressure, they live longer.
All right, and then so what else can we do besides checking our numbers to help us live longer and have better heart health?
Well, I will often refer patients to the American Heart Association website where you can find their Life Simple 7. These are 7 easy tips that everyone can do. Things like eating a healthy diet full of fruits and vegetables, less processed foods, less fast foods, getting regular exercise. We try to do 150 minutes a week, controlling your weight, controlling your blood pressure, your blood sugar, and treating high cholesterol. And then importantly, not smoking. By doing those 7 easy things, you can dramatically reduce your risk for heart disease going forward.
And you've seen patients turn things around.
Oh, for sure. You know, it doesn't take very much, and sometimes people are not aware of some of the lifestyle issues that can cause heart disease or heart problems in the future.
Yeah.
And so talking with your doctor or your primary care provider about the ways that you can improve your health is super important.
Okay. We want to tell our viewers, if you would like to find out more, you can contact Providence Heart Institute, 503-216-2088. We'll put that information on our website at KATU.com. Doctor, thank you so much.
Yeah, thanks for having me.
You bet.